The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, I hope you're all doing well today. I'm just on here to do a quick sound check, so if you can hear me, please click the raise hand icon in your webinar control panel. Perfect, thank you so much everyone. Okay, so I think we're going to get started. Hello everyone, I hope you're all doing well and that you are all keeping safe out there. My name is Sarah Clark and I'm a program coordinator with CIPH. Welcome to today's webinar, Pandemic Response, Advocacy to Date, and Opportunities for the Future. I'm pleased to note that we have 160 sites registered across Canada for today's session. Before I introduce our webinar presenter, please note that you will have the opportunity to ask questions at the end of today's session. You can do this by typing your question directly into the question box you see in the webinar control window on the right-hand side of your screen. Please save your questions for the Q&A portion at the end of the session. Also note that a copy of today's presentation will be made available to all attendees following the webinar, and you will have the opportunity to submit questions after this session has ended. Today's webinar presenter is Rob Lafort. Rob's professional background includes government relations, communications, and policy roles at leading national industry associations, where he has a track record of achieving results and building relationships with decision makers. Rob has extensive experience in media relation through numerous television, radio, and print interviews while serving as a not-for-profit spokesperson. Rob is a proud alumnus of Dalhousie University, where he was awarded the Governor's Award for exceptional contributions to the university community. He holds a Bachelor of Arts in Political Science and a Master's in Political Management from the Clayton H. Riddell Program at Carleton University. Ladies and gentlemen, please welcome Rob Lafort.
Thank you very much for that kind introduction. I'm really glad to be speaking today with CIPH members from coast to coast. I think this is a time that is as challenging as any that the industry has seen, and it's also one where there is considerable opportunity for the future once the sector gets out. So without further ado, I want to kick it off just by talking about, pardon me, a couple of starting phases that not only the sector but the economy as a whole has gone through, and society as a whole has gone through. COVID-19 has changed everything. There's no doubt about that. Whether it's the way we work, socialize, learn, or live, things are different. The way people are going through their daily lives, the way they're interacting with their families, the way they're earning an income, and the way that they're spending their leisure time has all changed. And governments have had to respond as a result. It's really critical to note that the entire approach of either the federal or the provincial governments where you folks live has been based on one key overarching principle, and that is reducing the spread of COVID-19. With no virus immunity built up in the population and no overall vaccine available, the only tool that the governments have at their disposal is making sure that people don't give this virus to others. The federal government has established an advisory committee, and that advisory committee is chaired in cabinet by Chrystia Freeland. She is the Deputy Prime Minister of Canada, and she also has other ministers on her team. And those are some of the folks in the photo here. Minister Patty Hajdu, the Minister of Health, Minister Jean-Yves Duclos, President of the Treasury Board, Minister Bill Blair, Minister of Public Safety, to name a few. In addition to that group, they are being closely advised by Dr. Theresa Tam, who is the Chief Medical Officer of Health of Canada, and Dr. Howard New, who is the Deputy, and they are both members of the Pan-Canadian Public Health Network Council. So that Pan-Canadian Public Health Network Council also includes the provincial public health officers and others nominated by their province to deliver public health advice to elected officials. The federal government's approach is what the provinces have mirrored from the outset. They have tried to focus on three key phases of action. The first phase is the secure phase, the second phase is the support phase, and the third phase is the recovery phase. And we're still in phase one. Securing is the principles where they want to make it as easy as possible for people to decide to stay home. So whether that is for their employment, if possible, or it's for social activities, the efforts afoot have been, they don't want to make it such that people have to leave the house to earn an income if they're going to get sick. And some of the programs and policies that the government has put forward are reflective of this. So the diagram here is Maslow's hierarchy of needs. This is a psychological evaluation of what people need to feel good in their lives and to maintain, good mental health. Physical security and personal safety are at the bottom of that pyramid. So if you think about it, the government's really mirroring protecting these needs so that folks can, pursue the other types of success, if you will, that humans like to pursue. They want to keep food on the table, they want to keep a roof over people's heads, and they most of all want to keep people working and in touch with the businesses that employ them. So if an employer has to lay somebody off, that terminates their contract, terminates their employment. They have to rehire that person. They have to go through all the steps of bringing somebody back in order to get them working again once the economy is ready for some semblance of a recovery. So they want to avoid that as much as possible. How are they doing this? They have made up these policy responses. So the Canada Emergency Response Benefit, Canada Emergency Business Account, and Canada Emergency Wage Subsidy are three of the most talked about, and one of the most recent is the Canada Emergency Commercial Rental Assistance Program. These are probably all laid out here in the order in which they are well described and well functioning. The Canada Emergency Response Benefit has helped over 7 million Canadians so far who have lost income due to COVID-19, and in particular, folks who have had either a layoff as a result or who have had their hours cut back so drastically that they do not earn at least $1,000 per month. So that's a flexibility piece that was introduced, and it's something that a lot of Canadians are using. We also saw today that the government introduced its employment numbers for the month of April. More than 2 million people are now seeking work in Canada as a result of COVID-19 from the start of April. That's a very, very challenging number. It's by far in a way, the worst jobs report in any of our lifetimes and in all history. The numbers for March were bad at 1 million, and they were already a record on their own, but these numbers eclipsed it. It looks like that was about in line with what a lot of the economists were expecting, because these are folks who are unemployed and looking for work. There are still some folks who've lost their jobs who are not currently looking. That could be because they don't have an industry to go back to right now. So They are, some of them, sitting and using the emergency response benefit and will be ready to join the labor force once it bounces back. Canada Emergency Business Account is a little bit different. This is one of the security measures for largely small businesses, and it's facilitated through the banks. And the effort here was to get this money flowing quickly to those who need it, who may not qualify for other programs. While they were designing other programs, this was one that they knew they could get out the door quickly and that could help businesses access funds that would also help them not just pay payroll, but also pay suppliers, fulfill contracts, etc. So if you go to your bank and you say, I'd like to take advantage of the Canada Emergency Business Account, they can give you up to $40,000. It is a loan, it is interest-free, and if it's paid back before December 31st of 2022 in full, you get $10,000 back as well. The Canada Emergency Wage Subsidy is probably one of the most talked about programs, and as of today, Canadian businesses are using the Canada Emergency Wage Subsidy to pay or help pay over 2 million Canadians. So that's 2 million Canadians whose incomes would not otherwise be guaranteed that the program is supporting. The government, I think, is happy with that number, but they also expect it to go up. In fact, I think they'd rather that number be high than the Canada Emergency Response Benefit number be high. So we believe that the Canada Emergency Wage Subsidy is now going to be extended past June. I think that was confirmed today, but the enabling legislation also allows that to proceed up and until the end of September if the government so chooses. So they'll just have to choose how much to fund it by. If your business lost over 30% of revenue in the month of April, vis-a-vis April 2019, that is pretty much the main criteria by which you can be eligible for the wage subsidy. And I'll talk a little bit more about where that comes from. So the last point, commercial rent support. The program has been relatively poorly defined so far, and it has not really rolled out. We do a lot of work with bookkeepers and accountants, and those folks are, livid would be an understatement about how this has been distributed. The money will go to landlords who choose to participate in the program to then help their tenants. And businesses that are tenants are finding it very difficult to figure out how they can plan to receive this program. Overall, each of the programs has seen some changes, some tweaks, some improvements, and the government has said that their goal is to continue improving all of these programs to help more and more Canadians and more businesses as the COVID-19 crisis persists. I want to bring to your attention some early stage wins for CIPH. In terms of the ongoing engagement federally and provincially, we've been able to work with provincial governments, the federal government, to make sure that plumbing and heating businesses and the supply chains for the sector were recognized as essential. Provinces were putting together the essential services lists very early on in the crisis, and plumbing and heating was recognized not just for the importance in helping to support the healthcare system and helping to support sanitation, but if you also think about, millions and millions more Canadians working at home, millions and more Canadians taking school at home, the residential sector is also important in that. And that's a big win that we can also point to at the federal level. When Public Safety Canada was considering what services would be deemed essential, if they had to go and use the Emergencies Act to support the provinces, we also had a commitment from Public Safety Canada that plumbing and heating businesses would also be considered essential. So it doesn't look like the federal government's going to have to step in with the Emergency Act and to use those powers, but if they did, CIPH member businesses would largely be covered. In addition to that, the emergency wage subsidy, which I touched on earlier, when that was first announced, the government was having conversations here in Ottawa about whether or not they would limit the program based on large businesses with large numbers of employees, or if they wanted to define larger businesses based on the capital goods that those companies had. So we were very concerned early on that warehouse products would also be included in that, and CIPH did a considerable amount of advocacy work with Finance Canada and with others to put some pressure on the Finance Department to make sure that that didn't happen. And as a result, there were no limits placed on company capital or size for the emergency wage subsidy, which is a big win for the sector. In addition to that, CIPH has been able to very, very effectively use its relationships and also further grow its relationships with some key champion parliamentarians. One, of course, being Senator Don Plutt, who's always been a champion for the sector, as well as Francesco Sorbera and the Honorable Judy Scrow from the Liberal side of things, who have been very tireless in their advocacy efforts to ensure that plumbing and heating businesses are reflected in the government's plans. And they're still working on a lot of the things that you as members are bringing forward and are saying to CIPH that need to be worked on. So where do we go from here? The next steps that we can anticipate are all about support. So we talked about the secure stage, now we need to talk about support. Even as the efforts to secure Canadians' incomes persist, the government is starting to think about how it can support sectors that have been hard hit. And the hardest hit sectors don't really include construction and services, and that is because a lot of your businesses have been deemed essential. However, hotels, restaurants, airlines, businesses that have seen their revenue drop to zero, sectors that have seen their revenue drop to zero, those are the ones that we're talking about more. But in construction and in supply chain business and in logistics, we are seeing some signs that support will start to be generated. There is a construction roundtable that's been established by the federal government. It's led out of Public Services and Procurement Canada. It engages Infrastructure Canada, Employment and Social Development Canada, Finance Canada, and Innovation, Science and Industry Canada. And those groups will be meeting with construction bodies to discuss the importance of getting support into the sector. One of the key things they're talking about is contracts and liability. The other thing that they're really focused on is personal protective equipment for people on job sites and in the supply chain. And in addition to that, they're also focused on federal projects and federally funded projects. So they want to make sure that they're getting money into the system. They're looking to speed up infrastructure projects. They'll be looking for other programs as well. Their efforts are also going to be underway to talk about employment and training. So I'm going to leave that for the very end, and I'll talk a little bit about the next steps and the opportunities that exist following that. In addition, one thing that I'll talk about more is federal and provincial and territorial guidelines for reopening. The federal government has taken a leadership role here. However, their leadership role has been to coalesce all the provincial interests to make sure that they're on the same page. It does not necessarily mean their plans are going to be the same. In fact, you will see that they're very different. So the federal and provincial territorial guidelines for reopening have come out. They are 7 principles, and they range from supporting vulnerable groups to limiting transmission and ensuring testing and capacities in place. But I think you all know that the government's priorities are going to be making sure that fewer and fewer cases spread, and that's really the crux of it. So provincial caseloads and the health system capacity will be a consideration. You don't want to open up a province that is very susceptible to a big wave of COVID-19 cases to run into that, because then their health system gets overrun, more people get sick, and more people die. In addition to that, some consideration is being given to sub-provincial regions. I have Montreal here as an example because Quebec on the whole looks like it's doing okay, but Montreal in particular is extremely hard hit, and it brings the average numbers up for the province tremendously. So Montreal is being treated a little bit differently by the province than any other part of that province. And we may see that over the months to come in other provinces as well. So, you could imagine a situation in which Manitoba is doing okay, and then all of a sudden there's a spike in cases in Winnipeg, and Winnipeg's got to be, brought back down to earth in terms of its reopening. The one thing I'd say is that nothing is guaranteed here. Governments will do what they can to limit the spread of this until we have a vaccine. Transportation. Transportation is majorly concerning for all of you folks in the supply chain and logistics and warehousing sectors when you're thinking about how to get your products into not just your own showrooms and your own local sales facilities, but also onto job sites and into the projects and into the hands of contractors who are going to be doing that work. So not just transportation between the provinces where, I can't drive from my place here in Ottawa over to the Gatineau side in Quebec unless I have an official reason for doing so. Those limits will probably be lifted in the not too distant future. But you folks don't have to worry about that too much because most of your businesses are essential and supply chains have already been deemed essential. But Canada and the US is a key thing to consider here, and I think it's going to be a challenge. The US government is going to put a lot of pressure on Canada to open its borders so that it looks like everything's getting back to normal. That is the perception they want to give. But the Canadian government is going to have some the Canadian government is going to face one of its biggest political fights ever in the efforts to maintain Canada's caseload status and by limiting transmission coming to Canada from the United States. It's been one of the ongoing conversations in Ottawa, and it continues to ramp up as we reach the May 20th deadline where something has to happen. Either we decide to open up the border more or we decide to keep it as is, but a decision point will be reached. So everything going forward is an experiment. We know that some of the provinces are further ahead than others. Ontario and BC tend to be sounding like they're taking things a little bit more cautiously. But the pandemic response and the joint recovery between all of the provinces, its goal is to minimize illness and death and minimize social disruption. And social disruption includes, making sure that COVID-19 does not spread further so that we can open up schools, so that we can continue to go to faith-based congregations, so that we can increase employment and get back to work and go to restaurants and go to concerts. The ability to even go to a funeral that's attended by more than 10 people now has been curbed in a lot of places. That is social disruption at its core. So I mentioned the range of the principles here, and I don't want to dig into them too much. This deck will be shared afterward, but I want to talk a little bit about the reopening plans in each of the provinces. So British Columbia is actually the province that released its plan most recently, and they have a phased step-by-step approach. You're going to hear me say the word phase over and over and over again as this presentation goes on. But they have a 4-phase plan, and there's some commonalities between this and what you're seeing in other provinces, except BC actually didn't shut down as many of its businesses at the outset. So a lot of businesses continued to operate, but they continued to operate on the principle that social distancing and physical distancing would be followed. So for its first phase, which is the current phase, essential health services, law enforcement, food and agriculture, transportation, and financial institutions are going to continue. And this is pretty much the items that have been open all along, the sectors that have been open all along, but they are identifying it as phase 1 because we're not starting at 0 in BC. Phase 2, they expect to start after mid-May, and in all situations, anything that's reopening will be reopening with enhanced safety protocols. So, newly scheduled elective surgeries will be there, dentistry will be there, physiotherapy, massage therapy, hair salons, barbers, restaurants with sufficient physical distancing measures. This is really, a list of things we all want to be open, just like they were before, except they're saying they'll be open with, less capacity. And I think that's important for all of you folks because many of those businesses are the businesses that are your clients. So, if you're talking about a restaurant or you're talking about, a medical facility, even some retail, they all need heat, they all need hot water, they all need sanitation. And I think, they're all going to need even more sanitation over the months ahead. In June to September in BC, we expect hotels and resorts to reopen, although things seem to be getting pushed back here. They want things like the film industry with domestic productions to be open between June and September, and they also want people to be going back to the movies and to symphonies, but they have said that there won't be any large gatherings. So, you could go to a movie and instead of there being 200 people in the theater, there might be 20. The big question that remains, and this is true for all provinces, it's true for the federal national picture, how much do people actually want to go out if they're putting themselves at risk? So these phases will only be rolled out if transmission rates remain low or start to decline. And we can expect enhanced protocols to be in place for the foreseeable future. The government of BC has gone probably the furthest in stating this. They have said that phase four will only proceed if at least one of the following is available. That is wide vaccination, community immunity, or broad and successful treatments of COVID-19. And that's when you start to see things like conventions, professional sports, live concerts, international tourism, bars and casinos opening, etc. That's pretty big for the British Columbia government to say that it's going to be dependent on that. They are some of the most cautious in their phase four or late phase applications, and I think it's probably the most realistic. In Alberta, we have the first phase starting as early as May 14th. So the provincial government there said that some businesses and services will be able to reopen with 2-meter physical distancing. Post-secondary institutions, they're going to be doing online courses, personal services like hairstyling and barbers again. We'll see museums and art galleries open, daycares with limited occupancy, maybe some summer camps, and then if you have a cafe or a restaurant, that'll be open, but with 50% capacity. So that's another thing that I think is key to know. If we expect businesses to open at 50% capacity, I think all of you as business principals or managers, what it would be like to operate at 50% capacity. My question that keeps playing over and over in my head is, do we actually anticipate that at 50% capacity, folks are going to hear or have enough margin to actually be able to operate? So will they then actually open up? Will they come back at full speed? Who is to say? Stage 2 in Alberta. So this timing is going to be considered based on health indicators. They've decided that they're going to let the public health officials tell them when it's time to go to stage 2. You might see some larger gatherings, and maybe schools are reopening, libraries, and more restaurants, cafes, and bars opening, but with reduced capacity, and then probably some larger gatherings and movie theaters and theaters with restrictions. I mean, you're going to see this over and over again as we discuss. But stage 3, all that timing will be limited based on health indicators again, and that would be the full opening of the economy, where they'll then permit larger gatherings. So again, we're talking about many weeks, if not months, for all of the phases that these governments are talking about. In terms of their foundational elements, they're basing a lot of this on the availability of testing and contact tracing and border controls, and whether or not masks and gloves and that kind of thing are available. So I'm going west to east here. Saskatchewan has a 5-phase plan. Their first phase started on May 4th, and they're going to allow other medical services, things like dentistry again. Phase 2 will start up 2 weeks following that on May 19th with some retail and personal services. Gatherings in this case will be restricted to less than 10. And then their phase 3, 4, and 5, that's to be determined, right? They're not going to say exactly what dates those will be. They're not going to say, you know, exactly what the conditions will be. They're just going to discuss that as it comes up. Phase 3, the capacity for a gathering would be 15 people or less. Phase 4, capacity for a gathering would be 30 people or less. And, you know, that raises questions for on-site work, for instance. You know, does construction continue to get an exemption for these public health protocols? I think that the answer is yes, but all of that is going to depend on whether or not they see the caseload increase or decrease in each province. In Manitoba, phase 1 is the current phase. Schools remain closed, health measures remain deployed, but you know, some of the things that could increase would be outdoor recreation, campgrounds, you know, retail or restaurants where you can have a patio or just a walk-up, not coming in and sitting down. And you know, phase 2, we're still talking about public health measures remaining. You know, the situation in Manitoba is not as bad as it is in other parts of the country. They've escaped relatively unscathed from COVID-19. We do work with, you know, the regulated nurses in Manitoba, and their healthcare system seems to be weathering the storm better than most of the other provinces. So, you know, in our discussions with them, they have said that, you know, their big focus is on maintaining personal protective equipment and having that available so that you know, no transmission continues. I will be watching Manitoba very closely to see if they end up in a situation like New Brunswick where there's no cases and they further lock down their borders just to allow their domestic economy to continue. And they would probably still allow supply chain and essential goods through, but you know, not allowing people to drive from Northern Ontario into Saskatchewan unless they had a very good reason to do so. Ontario is following a 3-phase plan, and as I mentioned before, Ontario is one of the provinces that is following the most cautious approach. The Premier has said in Ontario that their plan is not a calendar or a timeline, it is a framework. And all the efforts in Ontario, you know, chalk up to Toronto being very hard hit, but they do want to take the approach that the province does not reopen and then have to shut down again because another wave takes hold very quickly. And Ontario has some of the most densely populated parts of the country, as does Montreal, which I'll get to, but helping cities and towns adopt new measures that are going to allow people to take part in outdoor activities, you know, safely. That's a big focus of the approach. In Ontario, you know, the first phase here that we're working up to is that some workplaces and some small gatherings will be allowed, but those small gatherings are cultural things like funerals, weddings, and when I say small, I mean less than 10 people, so very, very small. The second phase will be determined based on advice from public health officials, and we'll be talking about more and larger gatherings and more workplaces. And then in that third phase, very similar to what you expect to see in BC, concerts and sporting events will be happening after phase 3. And, you know, the way this is being framed up by the folks at Queen's Park is not that phase 3 will be happening in June or July. It's that phase 3 will be happening much later on. So, you know, I'm not optimistic that I'm going to get to a Blue Jays game this summer, for instance. Although the city and the province are talking to the Blue Jays, the Raptors, and the Leafs about how they want to do their activities for professional sport over the next year. So we'll see what comes of that. But you know, Ontario is taking it slow and steady, and Premier Ford definitely sees himself getting a lot of praise for taking that approach. So I would expect more cautious process in Ontario unless we start to see the case numbers drop precipitously. Quebec is a really interesting case, and I know you know, it's an important province for business in Canada. It's also an important place for coast-to-coast trade. But Quebec has seen some significant drawbacks over the last couple of days in its planning. It had one of the most robust, most optimistic timelines for reopening out of any province, and it was also the first to announce its plans to do so. But Premier Legault and the Mayor of Montreal have had to push back now relatively constantly over the last few days their plans for reopening. On May 11th, we will see limited manufacturing with 50 or less people in a facility. We'll also see construction ramp up on May 11th. However, administrators must continue to telework from home if they can. The schools opening was a big contentious piece in Quebec. We expect that school openings will continue to be pushed back in Montreal, at least. Montreal is being treated differently than the rest of the province. The concern now is that if schools do not remain open, if daycares are not available, that a lot of people who do not have access to childcare won't be able to get back out and take part in the economy once it reopens, and that could be particularly tough for women. And governments are trying to rightly avoid that because they don't want women to disproportionately feel the burdens of this pandemic. One other thing I would add for the province of Quebec is, they've been hardest hit by the pandemic, and they are just right next door to New Brunswick, which has been the least hard hit by the pandemic. It goes to show the spread of community-borne illness is a major concern, and also that large gatherings have been a big source, as well as long-term care homes, which are a center of the outbreak. In New Brunswick, which is one of the oldest provinces demographically, and also one that has a less effective healthcare system, a less large capacity healthcare system, just like the Atlantic provinces. That province has been probably the least hard hit out of all provinces. I think it's got the longest streak of no new confirmed cases. They went as long as 11 days with no new cases, and out of the 118 total people who had COVID-19, I believe all have now recovered. Compare that to Quebec, which on Sunday had 1,000 cases announced. So New Brunswick's getting out of this relatively unscathed, and they have a 4-phase plan from red to green. They are color-coded, that started on April 24th, and it mirrors a lot of what we have talked about so far. I think the next province is interesting. Prince Edward Island, PEI, is in a similar way. They have not had as many cases, but they are also a very small population and a very rural population. Their plan is going to be implementing 4 phases with public health measures to be lifted over 3-week periods. And the first one started on May 1st. It's still no more than 5 individuals from different households, maintaining physical distancing, and you got to be in your yard, you got to be out in the driveway to do that. Our recreational activities, they really want to get golf courses up and running. They want to get fishing up and running, for leisure, not just for commercial. And construction services are ramping up and have already been ramping up in PEI. They want to make sure that childcare for essential service workers is there and that other healthcare ramps up too. But their next phase is planned to start on May 22nd. If they do not have any new cases, I see this, making a lot of sense that they actually run through their cases quicker than others, just because there are fewer of them and there's less community transmission. They have said that in PEI, the island will be closed to tourists this year. That is a tremendous portion of their overall economic activity. So that's major, and it means that they're prioritizing the health of the local population. In their last phase, which will start June 12th, they have the potential to introduce gatherings of no more than 15 people indoors and 20 people outdoors. And then, indoor dining and accommodation services will be for PEI residents only. So I don't know how they're going to police that, but I don't expect to see a lot of traffic coming across the Confederation Bridge or the ferries anytime soon. Everything else will be reopened after phase 4, which is what they call the new normal for PEI. Eventually, the province will allow citizens to spend time with family members in long-term care or others who are at great risk of severe illness. They'll be able to have, more parties. They'll be able to have festivals and events, but there's no indication when that's going to take place. Nova Scotia is the last province to put its plan together. It has not been released yet. They're developing that plan for lifting public health measures, and they've shared it with business groups. Their state of emergency will last until at least Sunday, May 17th, and they want to ease some of those public health restrictions, but mostly that'll be about outdoor activities. These are outdoor things that you can do pretty much alone. I've seen some folks from back home in Nova Scotia yesterday posting pictures of them at the driving range. So that's good news. But people will be taking part in activities that are different than what they would have been taking. I expect that they will follow very closely what New Brunswick and PEI are doing, just because of the proximity. However, they did have many more cases, and it was much more difficult for them to respond to the cases that they did have. So the biggest outbreak there is in a nursing home or long-term care home in Halifax, and it's by far the source of most of the deaths that have happened in the province. If they can get some of those localized outbreaks under control, I expect them to follow the example of New Brunswick and PEI a little bit more carefully. However, Nova Scotia is more likely to get new transmitted illnesses into it from things like shipping. They do have an international airport, although international flights have been stopped there. It is a bit more densely populated too than New Brunswick and PEI. That said, the province is not allowing cruise ships, for instance, for 2020, which was a big concern for them as far as sources of infection goes. Lastly, we'll come to Newfoundland and Labrador. The government has an alert level system, and they are currently at level 5 alert, which is bad. And then they're going to be trying to reduce that alert system down to level 1. And level 1 for Newfoundland is simply called living with COVID-19. That is illustrative of the province understanding that we're not necessarily going to get back to a world in which we do not have COVID-19. It's just how well can we live with it? How well can we handle it? The province has introduced one interesting measure that has gotten a lot of attention, which is called the double bubble rule, where a family in a household can go and visit another household, and that other household can go and visit them, but only those two households. They do not want to see other households introduced into those mixes. So, if you have young kids and 2 sets of grandparents, you almost have to pick one set of grandparents in order to follow that rule, which is quite concerning for some. Their efforts to bring this down is focused greatly on allowing more and more outdoor activities throughout these levels, but it also depends on things like being able to have more childcare services, being able to have more healthcare system capacity. They want to make sure that everything's rolling back kind of at the same time, and that you don't have one sector kind of take off while another sector is left in the dust. These are going to happen over many weeks, and even within many weeks, we're probably expecting to see gatherings of only 20 people as long as physical distancing can be maintained. So even at funerals, even at weddings, you're going to see people pretty well dispersed. Things like retail stores and stores and malls, that's only going to be reopened at alert level 3, which is still many weeks off. And then things like campsites will be offering overnight stays, but still with restrictions in place, at alert level 2. And we're looking way out past, the middle of the summer for that potentially. So it's a snapshot. It's not a detailed take, but you get the sense that the provinces are, they have different rules, they have different approaches, and those different rules and approaches very much respect, you know, what the situation is locally. I want to talk a little bit about things that you will not hear politicians say. You're not going to hear politicians say you should view all reopening activities as temporary or potentially temporary. What they want to say is these are our phases, we're going to follow these phases, these guidelines are in place, you know, we're reopening the economy stage by stage by stage. Montreal and Quebec is a very good example of this. If we start to see caseloads increase, everyone's going to be walking back to different stages, and the goal will be, let's not walk back, or let's not let the situation get so bad that we have to walk back to the starting from scratch stage where people are stuck at home, people are physical distancing, people aren't at work. You'll also not hear politicians say we should expect a second wave. There is some speculation that in the United States, for instance, where a lot of jurisdictions are opening up full bore right now, that their plan is to try to see if cases can increase and they can get to herd immunity. That is a very, very risky proposition, not just for public health, which is extremely risky, but also politically. I cannot see any premier of a province right now or the federal government staking their reputation, staking their legacy on, you know, opening up the economy very quickly and letting more people get sick and being okay with that. But regardless of whether or not these protocols are followed, the more people interact with each other, the more cases of COVID-19 we will continue to see. So, you know, unless a jurisdiction, unless a province can completely wipe it out, you should expect a second wave. That second wave will only be as bad as we let it be if people continue to limit their activities regardless, if people are wearing masks, if people are wearing gloves, if they're washing their hands, if they're following social distancing, and if some types of activities that, you know, typically spread the disease are not taken, then that second wave will not be as bad as what we're expecting. Politicians are not going to say that the economy bouncing back is unlikely with physical distancing measures still in place. So they are going to be talking about the economy coming back stronger than ever. They're going to be talking about a bounce back. The economy bouncing back is unlikely, you know, in the immediate term, like the V-shaped curve that everyone expects, the fast dip and a fast recovery. It's going to be very tough to get there because, you know, as I sit here in my place giving this webinar, if a movie theater opened tomorrow, or if my favorite restaurant opened tomorrow, it would be very hard to get me to go out and spend money there. It'd be very hard for me to go out to the mall and buy some stuff. It'd be, unless it's groceries, you know, it's very unlikely that people are going to be leaving until they have a higher sense that the you know, that the activities that they're used to are not going to make them sick. So that's one thing just to keep in mind, that the bounce back will be tough, and it should be expected to be a bit prolonged. In terms of those forthcoming political fights, I talked already about the Canada-US border. I think in general, there'd be long-term business adjustments that could be political. And then one of the other fights that's key is overall stimulus for the construction sector. So this is something we're working hard on. It's something that a lot of groups in construction have put to government. You know, we're working through the adjustments that need to be made at the current stage, but then looking ahead to the construction industry getting more support and getting funding to grow. That's going to be a critical part of what the government's put together to move the needle economically and to get joblessness under control. The last point about availability of personal protective equipment. Personal protective equipment is the very last line of defense that the governments are looking at. They believe that physical distancing is the best possible way to limit the spread of COVID-19. But if you are forced to be in a setting, or if you choose to be in a setting where you cannot physically distance, personal protective equipment is essential. And right now, Public Services and Procurement, Industry and Science and Innovation, or Innovation, Science and Industry Canada, they are frantically trying to get personal protective equipment, whether it's from overseas or whether it is from domestic suppliers for the healthcare settings. They're giving them the equipment to the Public Health Agency, and the Public Health Agency is deciding how to distribute with the provinces, and how the provinces, once they have the money, once they have the equipment, are distributing it there. So does the government in Alberta decide to give 3,000 masks to a hospital or to a construction job site? Those are big questions that still remain, and it is certainly a political fight that will be boiling over the next couple of months. The one thing that can get us through this is Canada's domestic manufacturing capacity increasing. I'll be watching that very closely. I know that there are a lot of manufacturers who have moved over to making new types of equipment, but some of the personal protective equipment we're talking about, like the N95 masks, those are extremely specialized. So it's a lot different, and making sure they're used correctly is a lot different than wrapping a scarf around your mouth and nose. So in adapting for the future, how adaptable can your business be? How adaptable are your workers and clients? And how can your product categories adapt for the post-COVID-19 world? Some of the things I want to suggest would be opportunities are, in not just hospitals, but in construction sites, in public institutions, in restaurants, in anywhere that large groups gather, and then also in maybe public facilities like parks, playgrounds, etc. People are going to have a higher expectation of sanitation. So that's one thing I would certainly put on the radar for folks. And then in addition to that, we expect that more sanitation measures are going to be required by governments in some settings as well. So if you're in the sanitation game, if any of your products are used not just to support hospitals or long-term care facilities, but also any number of places where folks can gather and they'll need to wash their hands, take better care of themselves, that is an opportunity, I think. And beyond that, the need for people to be able to adapt to working at a distance from each other, whether it is a public institution or even in their own homes, there are also going to be heating challenges at play there. There's going to be wastewater challenges at play there, and over the long term, we are going to have to see a lot of adaptation. So for CIPH, a couple of the opportunities and next steps that we're tracking are, there will be a focus on skilled trades training, getting people who are ready to help retrofit facilities, people who are ready to help put new equipment into facilities or homes or long-term care homes. They will be looking for folks to come into new sectors where maybe the workforce is a little bit old, and they'll also be looking to help get those 3 million Canadians who are looking for work right now into new jobs. So skilled trades is a great opportunity for the sector over the next little while to help more people create better labor availability. And beyond that, the government, you'll hear, is also focused on a clean and a green recovery, where they're focusing on the environmental sector, making sure that we're getting rid of market access barriers, whether that's model code harmonization, regulatory harmonization, the delivery of new products and services from other jurisdictions into Canada, and making it as affordable as possible to put the best, highest quality, most energy efficient products into homes and workplaces and other settings. Those are also going to be key. So I've talked for a long time. I know there's only a little bit of time left, but I'm happy to open the floor for some questions.
Thank you so much, Rob. So I'm just going to give a couple minutes here for some questions to come in. So please If you have any questions, please feel free to type them into the question box. I just want to give everybody on the call an update that we will be sending an email around 3 o'clock Eastern time today that will explain everything that Rob has gone over today. It does have a document about the rolling reopening of some provinces, so please make sure that you watch out for that. We do have one question right now, Rob. On the record unemployment numbers, any data on how much percentage-wise could be tied to the current oil/gas issues?
The numbers just came out today. I haven't dug into it yet, but the price drop was pretty significant even in January and February. So they had seen some difficulties there. What I'm watching for is whether or not the trend continues, that those millions of jobs that were lost are lost in like hospitality and restaurants and that kind of thing. Because if those service jobs are hard hit, then it's an indication that it'll be easier to bounce back from. Whereas if it is more the natural resources sector, the construction sector, and other places where we've got skilled trades people and skilled workers, then I'm more concerned for like the long-term health of the economy. I don't know exactly the sectors yet, just because the numbers just came out this morning.
Another question. The CEWS is for March, April, and May so far. We expect our revenue to fall to levels that would qualify, but after the program is set to expire. Any idea if CEWS would continue?
So the legislation that enables it will continue till September at least, before they have to bring it back to the House of Commons. The Prime Minister announced today that CES will continue. He did not commit to how far beyond, but the last period for May, I think, expires June 6th. So I would expect it to probably continue in some form or another from June 6th to likely September. What I think we can expect over the long term is that there may be a form of CEWS that gradually declines in the amount of year-over-year revenue that it allows you to qualify for. But in light of there not really being much of a recovery yet, and most of the provinces' measures being in place for a few more months, I think it will probably stay at that 30% decline number. And if it doesn't, they're going to get a ton of pressure from groups to keep it there until the economy is more back on its feet. So yes, it will continue after this period. We do not know exactly what it will look like.
Another question we just had come in. What is being discussed regarding additional construction industry stimulus? What do you think might be done?
So the biggest thing I think will come is we will probably get an infrastructure stimulus amount. I think the other thing that you could probably expect is more liquidity and more credit given to financial institutions to provide to any company that wants to be a principal or an owner on a project. And then in addition to that, I think you're going to see some money come directly to the sector for doing its own training or retraining, as well as, they're going to have to give some money to companies, I think, to help those companies purchase protective equipment once it's available, because the costs continue to rise as that demand rises.
Rob, you mentioned that the comparison for 30% sales reduction would be April 2020 versus April 2019, May 2020 versus May 2019, etc. My understanding was that the government offered a second option, which would be April 2020 versus the average of January/February 2020, and May 2020 versus the average of January/February 2020. Is this correct?
That is correct. Sorry, I was not comprehensive. I was just trying to give the Coles notes, but there is also that. And in addition to that, the other thing I would add is you don't just have to show cash accounting. You can also show accrual accounting. So rather than when the money was received, you can also show the government when that money was earned, which I think helps businesses, especially businesses in construction and and supply chains because it's more of a seasonal business.
So we'll just wait a couple more minutes for any more questions that are going to be coming in. And of course, if you have any questions that come in afterwards, you can feel free to send them to info@ciph.com, and we will make sure that they are forwarded off to Rob so that we can get those questions answered.
Perfect. I would be happy to answer any other questions that come in, and we'll make sure that any of the questions that we get also get relayed, if they are concerns, to the right people in government. Ralph and his team has been doing a fantastic job just keeping the pressure up on the elected officials and on the civil servants to make sure that their systems and their programs are responsive. And I know that pressure will also position the sector very well for the months ahead, because when they say, who do we need to talk to, they're going to be picking up the phone and talking to CIPH. So I just want to give you folks a lot of credit for that, and I think that as dark as the days are that are behind us, there are going to be some really good opportunities for growth over the next months and years. We just kind of have to weather the storm over the next little while.
Perfect. So the only other comments we're getting, Rob, is about how great the presentation was. So we will be sending out a recording to everybody, as mentioned at the beginning of the session. And there will also be a survey with that. So if you could complete the survey, that would be fantastic. And it doesn't look like we have any more questions coming in. So I just wanted to say thank you so much, Rob, for the presentation today. And thank you so much, everyone, for joining us for the presentation today.
Thank you all.